Namaste, and a very warm welcome to all of us here for the third days of IMTA's conference. And it has been 2 wonderful days of listening to so many people, their work, which resulted in the presentation that they presented. So with heart full of gratitude, let's start with this prayer today. It's in the language Tamil, so that's why I'm sharing the screen so that we all understand the meaning of it as I offer it. வீர வாழ்வே வாழ வேண்டும் விண்ணும் மண்ணும் வியந்து போற்றும் வீர வாழ்வே வாழ வேண்டும் விண்ணும் மண்ணும் வியந்து போற்றும் வீர வாழ்வே வாழ வேண்டும். பாரில் 4 நாளென்றாலும் 10 நாழி தானென்றாலும் பாரில் 4 நாளென்றாலும் 10 நாழி தானென்றாலும் யாரும் தாழ்மை போருண்ணாத லட்சியம் ஒன்றே கொண்டு நின்று வீர வாழ்வே வாழ வேண்டும். மேலும் மேலும் துன்பம் வந்து மேவுகின்ற போதிலும் மீட்சி கண்ட போதிலும் வேற்றியில்லையாகினும் காலனே வந்தாலும் அச்சம் காட்டினாலும் கொண்டதோர் ஆசையில்லாத கொள்கை தன்னை கைவிடாத உறுதி கொண்டு வீர வாழ்வே வாழ வேண்டும் விண்ணும் மண்ணும் வியந்து போற்றும் வீர வாழ்வே வாழ வேண்டும். It just not only applies to our life but to the IMTA movement as well. There'll be a lot of ups and downs in terms of where we started from the first year till now the 4th year, and it's everybody has to just look within ourselves to see how we can contribute to the overall vision of what IMTA stands for and how we can take it further. So again, a very, very warm welcome to everyone here, and let's straight away go to the presentation, and I welcome Sushma ji here. And Sushma ji, Srimati Sushma Kaushik, working as an HR professional, is an ADA certified music therapist. She is also a music therapist for special children at Meera Center for Music Therapy and Research and Education. We all know about Dr. Meenakshi Ravi and Meera Center for Music Therapy, and it's a great privilege and honor to have you here, Sushma ji. And she is pursuing her master's in counseling psychology. She's a trainer and NLP practitioner. She's from Bangalore. Welcome, Sushma ji.
Thank you, ma'am. Thank you for that introduction. Namaste, everyone. A warm welcome to a cold morning today. So, today's my topic is about, I would like to present first and then, okay. Are you able to view my PPT?
Yes.
All right. Okay. Today I'm going to talk about how music is important for early childhood development. As we all know, music plays a very important part in our culture. When talking about everyday life, music is present in a variety of social and educational activities. We listen to music everywhere in one sense or the other. Most of the ceremonies include a component of music while we use songs to celebrate birthdays or to worship God. Given this importance of music, it is no surprise that parents use music instinctively to express joy and to engage or calm their children. Research undertaken by team of researchers in 1990s showed that the exposure to music from early childhood onwards helped children to speak more clearly, develop a larger vocabulary, and strengthen social and economical skills, emotional skills. The psychologist Howard Gardner has told that music intelligence is as important as logical and emotional intelligence. This is because music has the ability to strengthen the connection between the body and the brain to work as a team. For instance, when dancing and moving to music, children develop a better motor skills, whereas singing along to a song helps them to practice their voice and also culture the voice. As we all know, music starts from the womb. So I would like to show a video on it.
Sushmaji, is there a sound associated with the video?
Yes, yes.
Um, I'm not able to hear. I don't know if anybody else is able to hear.
Uh,
I also can't hear it.
it's not audible, is it? Okay. Okay, probably after this, I'll just explain it what it is.
Sure.
In this video, we can see how the baby in the womb reacts or responds to music. And this is the second video. So just after the video, I'll just explain the things in it. Sorry. This is how the sound travels through. And the scientist wanted to know how the baby reacts to the sound or the music in the womb. So they had played a music type in this. They just wanted to know how the fetus is, whether the fetus is calm or agitated to the music. So they used two different music. One was the hip hop, and the other was the normal classical music. So they just wanted to see how really the baby in the womb responds to it. So they measure the heart rate. Now the heart rate is 128 beats per minute. But as soon as they put the music on, so they played a hip hop, and with this hip hop, actually uh, the baby's heart rate increases because the rhythm reverberates to the amniotic fluid where the heartbeat increases. Now it has become 155 beat per minute. So this was seen in the scanning what they did. So the baby really responds to music. So few babies were agitated when it listened to the hip hop music kind of music, while the other babies, like few other babies, were calm during the classical music. So really, they have taste from the womb itself. That's what we can say. So listening and fetal development. The womb is relatively quiet place, registering around 50 to 60 decibel. A normal conversation registers about 60 decibel. The fetus develop ear in the third week of gestation, but they don't become functional until week 16. While we know that the fetus can actively listen by week 24, ultrasounds reveal that fetus can hear and in turn respond to sound at week 16. Benefits of listening to music when pregnant. High stress level in expectant mothers can have negative effect on fetal development. Hence, music and singing has a soothing effect on the expecting mother and the unborn baby alike, and it contributes to a healthy and happy baby later in life. You can choose any kind of music you like, anything from classical to singing lullabies. And it also helps in connection of prenatal bonding. Music is also an important part of prenatal bonding. Listening to songs or singing lullabies sends calming chemicals throughout the body and into the placenta, facilitating the bonding and relaxation for both babies and mothers. Baby's ear and brain development. Listening to all kinds of music encourages early brain development in fetus because music facilitates neuron connections in the brain. Listening and experiencing music stimulates the fetus brain and assists with the growth of brain structures. New studies even suggest that babies remember music they listen to in the womb for up to 4 months after being born. So, listening to music while you're pregnant is definitely a good idea. Around 3 to 6 months of age, typical babies start experimenting with their voices to produce a wide variety of sounds, including shrieks, coos, sequels, yells, and other vocalizations. These random sounds quickly sort themselves into babbling or non speech that follows the cadence and patterns of speech. Consonant sounds soon emerge, and babies begin to experiment with repetition, rhythm, and complexity. Language acquisition or learning to speak is natural for most babies. In other words, they pick up the language simply through exposure. Next, coming to how much and why your baby reacts to music in womb. When a mother reads aloud, her voice has a calming effect on her unborn or newborn baby. Music will improve unborn baby's reflexes and improves auditory senses. It shapes overall personality, and also, as I told you, it helps in prenatal bonding. Next, when it comes to musical intelligence, researchers were able to establish that musicians more often than other people have both hemispheres of their brain involved at the same time, as they are equally active. In general, the IQ of music lovers is higher and their brain process information faster. The explanation of the same Development of both hemispheres of the brain is made by the fact that musical instruments are often played with both hands, and therefore the neural signals must be distributed evenly. Hence in kids, it also helps in general physical development. The pictorial muscle slings is strengthened and the posture is formed. And through ear for music, rhythm, and musical memory develops. And it helps in both skills of verbal and non-verbal communication are formed. The children learn to make decisions, to achieve mutual understanding, and to make compromises. And they also know how to connect emotionally, and he or she has the readiness or the ability to act as a team. Musical and rhythmic activity in a classroom is also of particular importance due to the formation of an accelerated exchange of information between the left and right hemispheres. The process of perception, recognition, thinking, and decision making are possible only through the interaction of both the regions, hence, each of which has its own specializations. Like how we can see in this slide, the left hemisphere and the right hemisphere are equally important and it's already interconnected through speech, recognition of letters, words, elements of the whole, awareness, aware movement, movement combinations, and also memorization of words and phrases. And it also helps in logical thinking. These come up with the left hemisphere, and the right hemisphere is involved with music, rhythm, noise, rhythm and intonation of speech, visual perception of the subject as a whole, and automated motion, and also memorizing music, pictures, smells, and intuitions. Next, coming to this slide, I'll just explain it to you how kids enjoy music in the early childhood. So this is how they teach in the preschools or and kids are equal actively involved in all the music and they like the instruments used like the shakers, the drums. So they usually do all these in the form of rhymes. So here music instructions, as we see, appears to accelerate the brain development in young children, particularly in the areas of brain responsible for processing sound, language development, speech perception, and reading skills. These results reflect that children with music training compared with other children's are more accurate in processing sound. The neuroscientists found the auditory systems of the children in the music program were maturing faster than compared to other children who didn't undergo the music training. The fine tuning of their auditory pathway could accelerate their development of language and reading, as well as other abilities like a potential effect on their overall development. This enhanced maturity reflects an increase in neuroplasticity, a physiological change in the brain in response to its environment is also seen. The auditory system is stimulated by music. This system is also engaged in general sound processing that is fundamental to language development, reading skills, and successful communication. The auditory system connects to our ear to our brain to process sound. When we hear something, our ears receive in the form of vibrations that later it converts into a neural signal. That signal is then sent to the brain stream up to the thalamus at the center of the brain and outwards into its final destination, the primary auditory cortex located near the sides of the brain. The progress of a child's developing auditory pathway could be measured by EEG, which tracks electrical signals, specifically those referred to as auditory evoked potentials, through which we can mainly understand how this music education and brain development happens hand in hand. And it also affects music effects on academic success. At the World Conference on Learning, Teaching and Educational Leadership, which was held in 2012, research studies from multiple sources were shared, through which they tried to prove that early music has an effect on the academic success. For a while now, music has been thought to provide an effective experience in schools for children to develop listening skills as well as for children who have learning disabilities. A child's active engagement in music can have many positive effects, including perceptual, language, and literacy skills, numeracy, intellectual development, attention, concentration, physical development, and many more. Music also has an impact on social and emotional development. Playing an instrument can lead to a sense of achievement as well as increase his or her self esteem. So, this is how. And the last, these are all the functional areas of the brain where each part of the brain has a major impact on the development of a child. A study of employees in the London University has proved that playing an instrument or even a simple noisemaker increase the level of intelligence and improves the general well-being of a child. Learning speech is long and challenging process, but through music it makes very simpler and kids learn the vocabulary and also the communication very effectively. In the course of class, with them for the development of speech, using musical instruments and toys, children listed out the various musical works and songs. So, in an experiment conducted, children, after undergoing such classes, were spontaneously communicating with each other and thus had a better recognition for their own native language, where the language skills also developed equally. So, this shows that how really music has an impact on early childhood development. So, parents are advised to actually make the children learn either singing or any other instrument so that it helps their overall development. Hence, I would like to say that music really has an impact on early childhood development. So, this is why music matters in early childhood development, as our brain process music similarly to how we process language. And music teaches young children self-regulation skills, and also our brain process music similarly how we process language. So with this, and thank you, Sairam sir, and all other dignitaries for giving me this opportunity to share a few of my knowledge on this. Thank you.
Thank you so much, Sushma ji.
Thank you, ma'am.
That was very well thought and very well presented presentation. And I'm
Thank you, ma'am.
again, like, so many presenters have come up and shared how music is related to brain and, what all changes happen in the brain. So thank you so much. And I would like all the audience, if there is any question, please post it on the chat box so that I can collect. And at the end of the session, morning session, after the presenters have presented, I can present these questions to the speakers. So thank you.
Thank you, ma'am.
So
Thank you, everyone.
thank you. And so we have our next Miss Tintisha Basu was not able to make it today for the conference. So I would now like to invite Dr. Vinod Ingalhalikar ji to come and present. And Dr. Vinod is Professor of Orthopedic Surgery, Director Spine Clinic, and Director of Music Therapy Projects, Juniper Hospital, Thane. He is also a member of IMTA, International Association of Music and Medicine, International Federation for Music Therapy, and we have all been very, very fortunate to have associated with him from the past 4 years through IMTA. And Dr. Vinodji, please come and share your thoughts about, I understand how you change your topic based on how all of us presented. The topic is understanding evidence-based practices and using them in music therapy. I think it's a wonderful topic because we hear the words evidence-based practices, but what does it really mean? I think that's a great topic. Dr. Vinodji, please come and share your thoughts. Vinodji, I think you have to stop the presentation and then unmute yourself and then start the presentation again. You're not able to hear you.
My PPT is on.
Yes.
Can you see my screen now?
Yes, and we are able to hear you as well.
Good morning, everybody. Right at the outset, I would like to thank IMTA and all other executing members for giving me this opportunity to share my thoughts. Well, last 2 days have been wonderful days, and I thought those who are non-medicos in the group perhaps would be benefited by understanding certain things about how the research is done, how the evidence-based things are done. And I'm trying to put some highlights on these things. Number one is, the first and foremost thing is, it's my humble request to all of you, please don't hate evidence-based anything. Well, I understand everybody wants to be in their comfort zone. Everybody wants to be, people are afraid of unknown things, but don't be afraid of evidence-based practices, because most things of our day-to-day life, which includes the technology on which we are communicating right now, they're all based on evidence-based work done by somebody or other, an amalgamation of all of them. If we want people from other countries to respect our music as a therapy tool, we have no option but to incorporate evidence-based practices along with our Indian music. Also, I do find at times an extreme thoughts and extreme views over people. And please understand that those who give value to evidence-based practices are not traitors, they are not gaddars. They're the people who equally love the music. And if you respect and like certain things in your neighbor, it does not mean that you hate your mother or your family members. Well, friends, all of us are here because we all love Indian music. Most of us are trained in classical Indian music, and most of us are practicing the Indian music almost on daily basis. All that we want to do is to help giving our Indian music its overdue, long overdue place of honor in the world of music therapy. And this is where we have to go with the world, and therefore we must create valid evidence of therapeutic utility of our music. Ethically speaking, when we recommend any therapy, we have a responsibility. And especially when fees are charged for those managements and treatments. And therefore, it goes ethically that the treatment modality must have been thoroughly tested, confirmed, and proved for utility and reliability by using valid objective criteria because objective criteria are confirmation and subjective criteria are impressions. That has to be done in a sufficient number of patients or clients. That has to be done over a sufficiently long period with a reasonably consistent results, and the whole modality or the treatment methodology must be reproducible in the hands of a large number of other practitioners. I can't say that this works in my hand. Well, if it works alone in my hand, that's not a methodology which others can use. And therefore, the modalities have to be judged on these criteria, and then they are to be applied to the people. Well, all of us know the effects of music, and I generally like to divide the music effects into two broad groups. One is called a generic effect. Everybody feels happy with music, whether you are passively listening to it or whether you are actively participating in it, especially if the music is familiar. Well, all this is often prompted by uh, lyrics, the words, etc. And then I enjoy it even more. I become even more happy. Most often, the patients may be pre-primed to feel good. Right from childhood, I have heard from my father that Yaman Kalyan is a king of ragas. He is a king of ragas. Then lots of musical compositions I've heard. I have learned Yaman raga. I have sang Yaman raga. I have taught Yaman raga. And over a period of time, my mind is pre-primed to enjoy Yaman raga, whichever way it is. So very often, with familiar music or familiarity gives us pre-priming. Therefore, we feel good. But remember, all this is a subjective effect. Of course, it's useful in some cases, but ultimately, it's a subjective effect. It's a subjective impression of that person of feeling happy, feeling good with that particular music. The other group which I look at is called specific effect. It's a specific effect on the brain and the body faculties, on the body functions, and this is usually objective now, like reducing the spasticity in Parkinsonism, or reduction in the stress hormone levels in the blood, or motor function improvement, or like we saw few minutes ago, the ultrasound 3D pictures of a fetus in the womb responding to the ring. All these are specific effects and they're objective effects. They're not only feel good effect on the behalf of that child, because the child has never been able to tell us. We are observing it as a third person. So these are specific effects, and I think as much as generic effect, which is what commonly is used, specific effects also have a tremendous importance, and we must give that. Well, we have always heard this, that how the music makes us feel good. We have auditory apparatus, where in response to the sound waves coming on the eardrum, electrical signals are produced. Those electrical signals go to what we call auditory brain center. It's not a one single center. It's a network of neuron cells starting right from behind our head to the behind, from left to right, everywhere. And they are very well dispersed in different areas of brain. Amongst all these areas, there's a structure called nucleus accumbens and a network called limbic system, which are connected with the emotion or emotion production. In these areas, there's a secretion of certain feel-good chemicals like endorphins and serotonins. The function of these chemicals is mood elevation, to give you feel of happiness, to give pain control, or not to bother of pain control, even if pain production is going on. The reduction in depression, anxiety, stress, etc. Well, friends, not only music does this situation, but this secretion of feel-good chemicals is also being done by alcohol consumption. That's why people go on the high. People forget their sadness, or substance abuses, or drugs, or having sexual encounters, or even after exercises. But again, as I said, these are all generic effects, and every music, irrespective of what genre, what raga, what style, whether North Indian or Karnataka, will prejudice. But this does not mean that they can be used in a very specified manner, which may be needed when we treat the thing. Well, there are three terms I would like to speak here. One is called evidence based. We'll study that further as we come across. It has the uh, highest value given. There's something called experience based. We have lots of people here who have lots of experience of carrying out musical therapy, and of course, their experience is valuable, and that has to be taken into account. But it's a little lesser value than evidence based. Why? How? We don't have time to discuss right now, but yes, it is. Then third thing, which is a very notorious thing, is called eminence based. Because I am senior, because I am so and so, does not mean what I all talk is to be respected or is respected. If you want to go to the rationality of my talking, you might find I am perhaps talking a lot of nonsense, which has no rationality, nothing. And when I come and say, oh, no wonder, I have done hundreds of such things. Oh, no, 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 this is my wonderful experience. Oh, no, no, this is all now. When you talk that eminence-based opinions, eminence-based talks are all absolutely given no value in that. Well, friends, I'm life member of an organization called Bhandarkar Oriental Research Institute in Pune. It's one of the world famous organization, a world famous body, and they have a library of old treaties of almost 16,000 plus books. I also have lots of such books in my own library, and I have studied them, all of them, as best as I can. And I feel there is a paucity of a true research in the past. It's not only in India, it's all over the world. In every country, in olden days, impressions were noted or written down, but no experiments and no confirmations are done. I have tried really hard to search for explicit discussions and evidence of therapeutic use of music, and I have not come across a direct mention about music as a therapy. None of them. All these are inferences. Even most old treatises like Samavedas, Gandharva Tattva, Sangeet Ratnakar, Narade Shiksha, all these, they have mention of a music, but they don't have a specific mention of therapeutic behavior. If there are any other literature in Tamil or other areas which explicitly give an evidence, I am willing to get corrected, and I'll be very happy to know that. We also don't know whether they were doing deliberate therapeutic use of music or it was a byproduct of the observation, whether any Vidyas or physicians were involved or not. Because I have talked to a lot of scholars of Ayurveda. I'm not talking practitioners. Talked to a lot of scholars of Ayurveda, and there is no clear mention of music therapy or use of music as a therapy in an Ayurveda science. Well, if you look at the books and granthas of ancient time, they were all handwritten granthas. And therefore, they didn't have many copies. Perhaps one copy was in Chennai, one was in Kashi, Uttar. And that's about all. The students never had an access to the copies of this unless they were allowed to make copies. And therefore, all these things was spread only through what you call Maukik Parampara. My speech, you hear, you speak, yes. And therefore, through many folklores, tales, legends, anecdotes, this reputation of music transmitted over generations. Even in other countries, the documentation was not much. To a very minimal extent, Hippocrates has done some documentation, but that's about all. Uh, as I see, and I stand corrected if somebody else shows me anything better, that the first music therapy center or a setup, formal setup, was established in Byzantine in Turkey in about 15th century. Till then, nobody had an official setup which was carrying out something. Thereafter, of course, a lot of things have come. Okay, there's no meticulous documentation of all that. Many misconceptions, the wrong beliefs got transmitted over generation without due corrections. And you know that over a time, this hearing and transmitting further, hearing and transmitting further, over a period of time, many get altered, vitiated, sometimes to the extent of losing the correct perspective of what the original person has said. All this has resulted big and small impressions of effectivity, but they are not confirmations of effectivity. Well, in present era, The clients for MT have different ages, backgrounds, requirements, and they come to you listening to your reputation or knowing that you are a music therapist. And therefore, a music therapist who gets concentrated influx of such people, they must possess skills to evaluate them correctly, scientifically, plan which method of therapy will be rational and useful, because there are plenty of different methodologies of using things. Then execute that therapy and not only be satisfied with that, reassess everything critically and perhaps unbiasedly. So today's rational music therapy practitioner must find best evidence for everyday practice. In other words, he must gain what we call information mastery. He must learn to critically assess information about therapies, the diagnostic tests, the clinical decisions, rules, and so on and so forth. And to do critical assessment, he must keep on asking questions. Is the evidence patient oriented? Is the evidence true? Is this really valid? Is this really so? Keep tearing everything into small pieces, and you will realize what is the validity of that particular information. It must not accept expert based information, including me, I'm talking right now, or colleagues, or CMEs, or presentation, or reviews and guidelines on the face value of theirs. They also must understand the basic statistics. And I would go a step further and say that they all must have all this information at fingertips. All of us now have either a computer or a laptop or a tablet or a phone while we are working. So at our workplace, we must have all these at fingertip available. We must have net connectivity so that you can refer to them anytime. What is actually evidence-based music therapy? Is it only a research evidence? No, research evidence was only one third part of the story. The most important thing is your clinical expertise, your experience of treatment. That has to be altered or modulated according to the patient's needs. An autistic child at age of 1 year is different than 4-year-old child, and then an 18-year-old child, or a 50-year-old autistic person. Their requirements, their understanding, their resources, their physical abilities, everything is different. So the patient preferences, your clinical experience, and research, everything. When you marry them well, properly, you have this. I would define evidence-based practice like this. It's a lifelong process of self-directed problem-based learning in which caring for one's own clients uh, creates the need to gather clinically important information about the diagnosis, the prognosis, theory, the management, therapy, and lots of music therapy issues. You will all agree with me, there is a huge information explosion going on everywhere. And all of us, whether we are full-time practitioners of music therapy or person like me who also does lot something else, we have very little time available. And if you look at this particular chart here, it's a very representative chart of, say, what happened 20 years back, 10 years back, and today. The publications, the research papers, research information coming up is exponentially rising up. And this is so in every field, whether it's engineering, whether it's a aviation field, whether it's a nuclear medicine, or whether it's simple electronics. Anywhere, all such things are going on. And therefore, if I want to be Vidwan or Pandit, I must study, but not only browse. And I'll just give you some figures and let's see what they mean. If I'm a general medicine physician, I must read 17 articles per day for 365 days. If I'm an orthopedic surgeon, I must read 14 articles per day for 365 days. If I'm spine specialist, I must read 11 articles per day for 365 days. And my guess is, for a music therapist to be a Vidwan and Pandit, he must read and digest 6 to 7 articles every day for 365 days. Can I really do that? Can I really manage that? Well, that becoming Pandit is not evidence-based. The evidence practice methodology suggests that instead of routinely reviewing the contents of dozens of journals and books, you target your reading to issues related to specific client problem. develop or learn to develop relevant clinical questions, and then search the current databases for it. What this means is all this converts the abstract exercises of reading and appraising the literature into a pragmatic process of using the literature to benefit individual patients. And simultaneously, it is expanding your own knowledge base. Well, this is what we call hierarchy of evidence. If you look at this pyramid, on this side you have quality of information, and as you go up the pyramid, you find the information is more qualitative and more valued. On downside here, your amount of information, how many patients, how many people were treated, how many such things are there. And for a lower evidence, lower level evidence, you need a huge amount of database, like say 1,000 patients or 2,000 patients or 5,000 population. As against, you go to level 1, even 5 properly documented evidences can give more value. And these are different names given to them. There are sub levels. We'll not go into details. We will look at them only as far as we are concerned. Well, the lowest level, what you call level 7, is animal studies or lab studies. Well, they are useful in development of drugs or methodologies or progression of diseases. They can test the effectiveness of a treatment. They are sometimes useful in music therapy. I don't know whether the ultrasound studies which we saw earlier, whether they could be called as laboratory studies. If they can be grouped into this, they were extremely useful, extremely important. Now you have next what is called case reports. Most of the traces which were presented in last 2 days belong to this particular category or level 6. They're descriptive reports of one patient case or a collection of patients treated in a similar manner. But they were not treated with the control group, somebody who were not treated but also studied simultaneously. They did not have that kind of comparison. So these are case report, case studies at level 6. As you go up further, you have studies where you have determined the music therapy mode and the outcome in a patient of a group of patients called sample group. And you also studied that in people without having given either that treatment or without such thing. This is something called cohort studies. We will not worry about them. They're large population studies. Let's say, for example, when we studied the COVID effect of COVID vaccination or COVID occurrence in people, the studies which were quoted and came, they were all cohort studies. Probably they are not as useful to us in music therapy. This is the most important part of the story, what we call randomized control trials. In this, the individuals are randomly allocated to 2 or more groups. One group which received music therapy, the other group which does not receive music therapy. And then they are followed up to determine the effect of music therapy over a long period. And ideally, the valid period which is considered is about minimum 2 years. And minimum case number is about 30. That's what is scientifically. Not only that, this is something called blinded studies. What do we mean by that? Single blinded study, the patients don't know which group they belong to. Double blind study, even the people who are conducting those studies don't know which patient has gone to which, but they do the experiments. And the triple blinded study are the analysts or the people who analyze the whole system later on come to conclusion. Even they don't know which patient has gone to which group, what has happened. They will only unbiasedly put that. It's something like paper correction in an examination where patient student's name is not there, only his number is there. So this is something a blinded studies, and they are very, very great value. And this is something we all can use in music therapy. Systematic reviews are the published articles, published studies are analyzed in a very systematic manner. They're standardized methodologies, which include identifying, selecting, appraising, summarizing the primary studies. Like all summaries present, all studies presented yesterday. If I study all of them, put them together and make a review article of that, that's called systematic review. And the final or the most respected evidence is called meta-analysis. It's a statistical technique of qualitatively combining the results of multiple studies. So all randomized control trials, the systematic reviews, I combine all of them together and come to a conclusion in a single pooled statement or a summary estimate saying that yes, this so and so is the best treatment available for all such things. So all these are things. And the best research method, as far as we are concerned, randomized control trials are considered the best or most rigorous way of investigating music therapy investigations. Cohort studies are basically observation, and there you do not intervene. You don't do anything. You don't give music therapy. Whatever is going on, then we just study them. And therefore, they're less useful. RCTs can be truly called as experimental studies, and the scientists intervene by giving XYZ music therapy and then assess the outcome prospectively. I decide everything today, make all the criteria, all parameters, note them down. I fill up lots of investigation information about the patient, carry that information over a period of 1 year, 2 year, 5 year, analyze all of them exactly same manner, what we call in a prospective manner, and they are basically. When we talk of case control studies, they're essentially observational and very often they're retrospective studies. I cannot go back and create certain parameters that I need today retrospectively in patients which were done 2 years back, somebody else. So analyzing scientists cannot create data respectively, therefore they may not be as useful. When we talk of evidence-based music therapy, these are certain steps which I think we should follow. Step 1, you must frame a proper, pertinent, focused, and answerable question. Then you must search the available literature. You must do critical appraisal of the literature. As I said, tear it into pieces and analyze. Then integrate that evidence with the clinical expertise of your own and the patient's parameters and values. And at the end of that, evaluate the process, analyze, reformat, evaluate, reformat, and finally come to the conclusion. This is how we must behave. When we ask questions, there are two types of questions here. One, what we call as the background questions, where when we talk of autism, if I don't know what is autism, what is the reason for autism, what is the underlying mechanism for autism, how do I diagnose that, how is it detected, what is routinely done, all these are questions which are not related directly or taking my study forwards. They create my baseline or my background, but they must be asked if I don't know them. If I know them, fine. I go ahead with foreground questions. What is the new base knowledge? What is the world literature talking about treatment of autism? Is there a new treatment? Is there a long-term improvement possible? This is how we'll formulate question. And this is a methodology of framing the questions. It's called PICO, that is patient or population. What are the intervention that we're doing? What are the comparison? What's the outcome? So for example, I would ask a question that in autism spectrum children, does using percussion instrument compared to singing improve social interaction? This is the question. The underlined words here are the keywords which I type in when I'm searching the articles, and I will get from all over the world database what I want. Or the another question could be, in anxiety neurosis, does active group singing compared to passive rag listening improve anxiety scores? All these are again. Or for that matter, in florid ovarian malignancy, listening to rag Malkams compared to rag Yaman Kalyan give better pain relief? This is how we must formulate questions. It's not difficult once you learn to do that. Once you do that, you do the literature search. The common search is a traditional print resources, textbooks, journals, or nowadays browse online electronic basis. All of us are aware of that. I love to create my own database. And this is something I found extremely useful. I create a Word file of different topics and I give title, music therapy, autism related info. When I'm reading something, either in a textbook or in a journal, I underline that, I highlight important things. Then I create a keywords from that. I enter them in my Word file. I write which book, which page number there. If I'm online, I collect the keywords or an important statement from there or Q statement from there, enter it in my database file of Word, and I also add from which journal, which year issue, which page number it has come. If I convert that into link, when I go and click on it, it will automatically eventually open that particular journal, that particular page, if it's online available. And over a period of time, you yourself will be able to create the databases in Word. Each file useful to you. You don't have to go back to certain things again and again. You already have your information. You already expanded database there. Well, what is the best way to know which is a good study? What are the common features of high quality evidence studies? It must be relevant to the specific issue. It must have as large number of subjects as possible. Ideally, the patient must be assigned to groups randomly. It must be at least double-blinded. It must also be placebo-controlled. It must be prospective. Prospective, as I said, from today onwards done study rather than done gone and searched previous 2 years. And during that, suppose I start studying 100 patients today, not more than 20% people drop out of that study. If it's less than that, the validity statistically is a poor. Then is it replicated in multiple centers? Has somebody else also done it? Or have I myself conducted it over multiple collaborators in multiple studies? And whether the reviewer are not connected with the study. The analyzers, the analyzing scientists, they are not connected with the studies. They are not part of the research team. Then it's best article. Well, how is music therapy planned then? You must understand the disorder in a complete totality. You must identify the problems and difficulties. Say, for example, a patient of Parkinsonism has multiple difficulties, multiple problems. I can't start treatment all of them together. We must prioritize them sequentially. Some solutions depend upon earlier stages of improvement. Then we address each problem individually in a sequence and either individually or in group. Then we decide what technique for MT is most useful. And as I said earlier, assess, design, reassess, redesign, and then progress. Please don't forget, anything that you do must have a very systematic documentation available. Well, friends, we have no option but to create evidence. And who's going to create evidence for our music? We are the people who are going to create evidence for our music. So let's not shun ourselves from evidence-based practices, evidence-based researches. Don't abhor it. Don't be afraid of it. It's very easy to learn this, very easy to formulate, very easy to implement. And please learn that. If you can learn at advanced age how to use computer or how to use a smartphone, you can obviously learn this. Well, friends, music is a music, and music gives us wonderful happiness. Let us create more happiness by creating more evidence, scientific evidence, and give our Indian music a due place as a high quality music in the world of music therapy. I once again thank everybody. I thank Dr. Sai Ram for allowing me to speak. Thank you very much.
Thank you, Vinodji. I'm sure, I'm not in a position to even say anything about the presentation. I'm not at that level, but I think all of us who really want to practice music therapy and who are either fond of already documenting or who don't feel the need of documentation will be inspired by your inputs and the way you have put each point, like what is the difference between evidence-based, experience-based, and eminence-based. And then that PICO, that was really something that connected so much. And I'm sure each one of us here in IMTA or in the audience who are probably not members of IMTA, everyone would have something or the other to take away from your presentation and apply it in their daily lives. As you said, so much things have to be learned on a daily basis. Yes, it's so very true. I think habit formation is something that is very, very important. Documentation is a habit forming thing, everything. And there is start to everything. And thank you so much for bringing in that positivity at the end, saying that, it's simple. It's not complex.
It is not difficult. It is not difficult.
It's not difficult. So thank you. Thank you so much. We have our next presenter, none other than Dr. Vijay Lakshmi Subramaniam, and we all know her. Dr. Vijay Lakshmi Subramaniam, General Secretary, IMTA, is a Carnatic classical vocalist and a music therapist. She's professor and head of the department of, okay, every time I have to pronounce this, I don't know if I'm pronouncing it right or wrong. Otorhinolaryngology.
Otorhinolaryngology.
Thank you. Head and neck surgery. Yenepoya Medical College. Yenepoya deemed to be University Mangalore. She is also a fellow of the Foundation for Advancement in International Medical Education and Research, and has over 40 published papers in international and national index journals. We are very, very delighted and honored to have Dr. Vijay present her work and presentation here. Welcome, Dr. Vijay.
Thank you very much, Shobha, and a very good morning and namaste to everyone. Are you able to see my screen, Shobha?
Yes, we are.
Okay. So thank you very much. I'm truly humbled seeing all the presentations over the last 2.5 days or so, and I would like to bail myself out before I make my presentation to say that I'm presenting the results of a work that is in progress. It's a very, very small project that I have taken up, and it's a very small group of individuals as well. There are quite a few confounding factors. It is just a pilot study, and I would like to take this forward, and I invite all your inputs to take this study forward. So I will be presenting the impact of music on the quality of life of elderly patients with dementia. So there has been a demographic shift. Life expectancy has been increasing, and hence the population of the elderly, the senior citizens over 60 years, has been increasing, and it is expected to nearly double from 12% in 12% to 22% between the years 2015 to 2020. By 2050, it is expected that 80% of the senior citizens will be living in the low and middle income group countries. There are about 10.4 crore senior citizens in our country, of which 5.3 crore are women and 5.1 crore are men. And it is expected that the elderly population in India will also triple by 2050. So one thing we need to realize here that almost 1.5 crore of the elderly population in our country live alone, and nearly 3/4 of them are women. Now, as the elderly population increases, there is also increase in the problems that are faced by the elderly, and elderly usually have problems which could be physical, psychological, which could be cognitive, and also social. So dementia is one of the problems which elderly face. It is one of the commonest problems which is faced by them. It is characterized by impaired ability to remember, to think, or make decisions that interfere with doing their everyday activities. And Alzheimer's disease is the most common type of dementia. In the entire world, currently, more than 55 million people live with dementia, and nearly 10 million new cases are getting added every year. So, Dementia is a condition which affects memory, attention, communication, reasoning, judgment, and problem solving. And it also affects visual perception beyond the typical age related changes which are associated with vision. Um, Whenever a person has a decline in memory with any one of the following four disabilities, that is, failure to speak coherently or understand speech or written language, inability to recognize or identify objects and including people despite intact sensation, inability to perform motor tasks, inability to perform any sensory functions or comprehend activities, and also lack of abstract thought, judgment, and ability to plan and complete complex tasks. Now, all of you will agree with me that music is a powerful and non threatening medium which can be utilized to bring about unique outcomes. Music is closely tied to our emotions and our memories. If you can recall, when somebody sings the school prayer which you were a part of some 20 years or 25 years ago, it will give you pleasant memories of school life. So also this can happen in the elderly. It eases stress, it keeps us attentive and energized. It is a sensory stimulation which provokes responses because of its familiarity, predictability, and the feeling of security which is associated with it. Now, many of my previous speakers have already mentioned how the music uh, works on several areas of the brain simultaneously. So, whether you play music, whether you sing, or whether you listen to music, several areas of the brain can be, impacted by the music at the same time. So, I'm not going to get into these details. Now, this is a slide that is just highlighting which components of music impact which components of the human brain. So, the pitch acts on the anterior, posterior, and the superior temporal lobe of the brain, which is close to the ear. Tempo, the hippocampus part of the brain. Timbre, again, the temporal lobe of the brain. Emotion triggers activity in the amygdala, the hippocampus, and the cortical and the subcortical connections. So, in dementia, music can help evoke the lost memories. It can soothe and manage frustration and agitation, and it can encourage social bonding because dementia creates a disconnect between the dementic person and the social contacts, particularly the close family members and the caregivers. So, with that small introduction, uh, the objective of the study that I did was to determine the short term effects of a music intervention on the quality of life of persons with dementia. So, before I go into how I planned the music intervention and what were the results, what were the observations of the music intervention, I will just present a brief review of the literature. Although I have reviewed several articles, maybe about 50 to 60 in number, I was disappointed that there is not a single article to which has demonstrated the efficacy or the impact of Indian music on dementia. And just to, in the interest of time, I will be just summarizing 4 or 5 articles which I found, are the latest, which have been published in the last 3 or 4 years at the most, and they were quite interesting and helped me in think and plan the present study. Now, this is a study of 298 participants having the Alzheimer's dementia of varying degree in the sense it could have been mild, moderate, or severe. Uh, the participants were divided randomly into 3 groups. So, one was a singing group, the other was a lyric reading group, and the third was a control uh, group. The singing, all the groups received their regular medical therapy, which was prescribed by their concerned, medical practitioners. The singing group was asked to sing their favorite song or listen to the songs twice daily for a period of 3 months. The lyric leading group was made to read the lyrics without the melody of the songs. So twice daily they were asked to just read the lyrics for twice daily for 3 months, and the control group received only the standard care of treatment that is given to the dementia patients, and there was no music or lyric based intervention planned for them. All the participants of the study underwent a series of cognitive tests, behavioral tests at the baseline, and then at the end of 3 months, and then at the end of 6 months. Now, what were the results of this study? The researchers observed that music therapy was more effective than lyric reading for improving verbal fluency and psychiatric symptoms in Alzheimer's dementia patients. They also found that music, in addition, enhanced memory and language uh, abilities in persons who had moderate to severe Alzheimer's disease. However, there was, they did not observe a significant improvement in the daily activities of patients, whether it was mild Alzheimer's or moderate Alzheimer's or severe Alzheimer's. Now, here I am presenting the methodology and the results of a study. I'm just summarizing the randomized control trial. Uh, uh, Dr. Ingal Halikar just shared with you what is a randomized control trial, where as one arm you have the study arm, on the other side you have the control arm, and the study is done to assess the effects of the desired intervention. So here, in order to assess the effects of music therapy on anxiety and depression in uh, persons with Alzheimer's type dementia, a randomized control trial was done. This was a single center trial, and the treatment group and the control group, there were 30 participants, which were divided into one arm, that is the treatment group, the other was the control group, each comprising 15 patients. Now, they measured the anxiety and depression of these patients using the Hamilton's anxiety scale and the geriatric depression scale. So the principal endpoint was described as the anxiety levels, which were measured on a 24-week follow-up at 1 week, 4 week, 8 week, 16 week, and 24 week. Similarly, the depression scores from the geriatric depression scale, which served as a secondary endpoint. Now, they found significant improvements in both anxiety and depression from week 4 to 16. And at the end of 16 weeks, they stopped the therapy, and they found that effects continued to persist 8 weeks even after discontinuation. So, this is another study, which is again a randomized controlled study, which was a multicentric study conducted simultaneously at 9 institutions in Italy to evaluate the effects of music therapy on the behavioral and psychological symptoms of persons with mild to moderate dementia. The participants were divided randomly into 3 treatment groups. One received active music therapy, the second one received listening to music, and the third arm was a control arm, which received only the standard care. However, the music therapy and the music listening group also received the standard care of treatment. Now, the behavioral outcomes and the psychological outcomes were evaluated using the neuropsychiatric inventory, the Connell scale for depression in dementia, and the Connell-Brown scale for quality of life. Now, this was a study which quite disappointed me, because having grown up in a musical family and having grown up, waking up to music and sleeping with music, I had a conviction that music would work for everyone. And I was not so happy seeing this study. They found that there were no significant effects on either of the groups. And in fact, all the patients showed reduction in their behavior, their psychological symptoms, and their quality of life. So this was a study which actually prompted me to think uh, maybe there was something wrong with the way they did the study, or the way they administered the music, or the questionnaires or the scales that they used, and or perhaps you know uh, music really didn't have an impact. So let us, why not we try, because culturally Italians are also different, and they will have many other modes of uh, uh, entertainment or whatever for themselves. So I thought maybe that is why it didn't work as well. And again, the socio-cultural background from which the participants came also could have probably had this kind of results. So uh, going on to the next study, this was conducted in New York. They conducted this study to assess the value of music therapy as a pharmacological intervention in participants with dementia who experienced symptoms of agitation, depression, and wandering. So the study included 132 participants, and they were assessed twice, 2 weeks apart, that is before the intervention, followed by the intervention for 2 weeks, and they were done, and two more assessments were done 2 weeks apart using the Connell scale, the Algaze wandering scale, the Cohen-Mansfield agitation scale, and the uh, functional assessment questionnaire. So these researchers found that there was a significant reduction in the symptoms of agitation and depression. However, no change was noted for uh, the wandering that is seen in the dementia patients. To evaluate the effectiveness of implementing a short protocol music therapy to alleviate stress and improve the emotional status of patients with Alzheimer's dementia, a study was done comprising 25 participants, and the factors that were studied were depression, anxiety, apathy, cognitive decline, mood, and behavior. And what they did was personalized playlists were prepared as per the preference of the participants, and they were given, sorry, so the music therapy intervention was given for 60 minutes, and the person's saliva, the participant's saliva was collected before and after the intervention for estimating the salivary cortisol levels. And the estimation of salivary cortisol was done using the ELISA, the enzyme linked immunosorbent assay. The HAD scale, the Hamilton Anxiety Depression Scale, was used to assess anxiety and depression. Now, these researchers found that music therapy significantly lowers the stress and improves the HAD scores. And they also found there is a linear relationship between anxiety and depression and the cortisol levels. So, with this literature, uh, what is being done, because I already told you I'm presenting a work in progress. Persons with a documented evidence of dementia, that is through a mini mental status examination, when they have a score of 10 to 25, they were included for a study. And why those who had lesser scores, or different scores were not included, is because when I went through the validation of the Alzheimer's disease related quality of life questionnaire, they said that questionnaire is reliable and it is valid only when it is used with persons having dementia scores between 10 and 25 based on the mini mental status examination. Now, music, how we establish the music preference. So, in clients who could respond to us clearly, we interviewed the client. Wherever the clients were not in a position to respond to us, we interviewed the caregivers to assess their music preference. And We also, ask them questions to determine the significance of music in their life prior to the onset of dementia. Now, um, we just to tell you in brief, after this, we either read out or we, asked the questions to the caregiver. If the client was in a position to answer, we directly read out the questions which were there in the music preference scale. And I should thank this music preference scale uh, was shared with me by Dr. Durgesh Upadhyay, our own IMTA member. It's a psychometrically validated scale which he has already validated, and it is published. And we use this scale to determine the music preference. So before we gave the music intervention, we used the Alzheimer's disease-related quality of life questionnaire, which comprises of 13 questions pertaining to their physical health, energy, mood, their living conditions, memory, family, marriage, their friends, their self, ability to do chores, ability to do things for entertainment, and life as a whole. So we administered this questionnaire as well, and this was also wherever they could do it themselves, it was given to them to do it. Wherever they could not, we read out the questions and took their answers. So, I had a strong conviction that music therapy in people with cognitive impairments and dementia can improve the perceived quality of life and well-being, and it could delay the progress of this disorder, and that's why this study was undertaken. So, music interventions were given. Uh, Okay, we gave active music therapy as well as passive, that is listening music therapy, both individualized as well as group sessions. The active and group interventions, that is the individualized interventions and the group sessions, were carried out 2 days a week for 4 consecutive weeks. But the listening part of it, we shared the music clips of the participant preference with the caregivers and the family members wherever possible, and we told them to make them listen to the music. So we included only participants who could sit at least on a wheelchair or were mobile for at least 45 minutes. And those who were confined to the bed, we did not include for the purpose of the study, because we could not involve them in the group music sessions, and also in individual sessions where we wanted them to, participate with us to the rhythm. So that is the second part of the study that we are planning in future. So this is only a pilot, and I'm still presenting to you work in progress, as I said earlier. So at the end of 4 weeks, we again administered the Alzheimer's disease-related quality of life questionnaire to the participants, and we also took a feedback from the caregivers and uh, or the family members to find out what changes they had noticed in the dementia participants. So these numbers are actually not important. Our study comprised of 11 participants, 8 of whom were male and 3 were women, and uh, 6 of these participants were in the 80 to 90 year age group. We had one participant who was aged above 90, 4 were in the age range 60 to 70 years, and of these, actually, 4 of them lived in a senior care center. Rest of them were being managed by their family members, either with help from these uh, home nursing agencies or on their own in their homes. So we went to their homes actually to give the individualized music therapy sessions. So whenever I went, I was accompanied by one of my first year MBBS students, a 19-year-old who also plays the violin, and I used to carry a lot of my instruments with me, which includes the kartal, uh, 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 this small, this little dholki, then the duffly, the other handheld instruments like the markas, little tiny little things, whatever I have with me, I used to carry, and of course my I play a little bit of keyboard as well. So I used to carry my keyboard along. My car was like a mini orchestra, center when I used to go to their houses. And one of the patient's family member was very kind enough to spare his terrace where we could, get together all these participants to give the group sessions. And for those who lived in the senior care center, we did it in the senior care facility itself. So based on the music preference scale that we gave, I'm just listing out what were the music preferences. They preferred bhajans and devotional songs. There were people who preferred old film songs, both Kannada and Hindi film songs, and there were preferences of both slow and fast songs, and particularly, more than out of the 11, at least 8 or 9 of them preferred Mohammed Rafi songs and Kishore Kumar hits, and also the Talat Mahmood and Lata Mangeshkar songs. There were people who preferred Indian classical.
Dr. Vijay, sorry to interrupt, just 1 second. Prakash ji, if you can please unshare your presentation. Dr. Vijay is presenting, so we would like to see her presentation. Prakash ji, I think you started presenting. If you can stop. Thank you.
Can I continue?
Yeah. Yes, Dr. Vijay.
Do I have to share my screen again?
Yes, please. Yes, please.
Just a minute.
Thank you.
So can you see my screen?
Yes, Dr. Vijay.
Okay. So these were the musical preferences which are listed in this slide: bhajans and devotional songs, old film songs, slow and fast as well. Indian classical music, there were people who enjoyed both the South Indian and the North Indian classical music. And there were many of them who like the local folk music, that is the Yakshagana music, which is popular here in coastal Karnataka. And of these 11 participants, we had two Catholics who were there with us, and they preferred the Christian worship songs. And actually, since yesterday, someone was asking continuously as to whether this music will work for, you're chanting Omkara and you're doing this, and you're doing the Hindu prayer, Hindu mantras. Will it work for people of other religious backgrounds? I would like to say, irrespective of which religious background my client belonged, I started the music therapy session with the Omkar and the small prayer. The reason is I could tell the caregivers and the family members that I am praying so that I can do the best for my client, and that is a practice which I have kept ever since, for many years, just to invoke the blessings of the Almighty to do good in whatever I do. So any day I write a prescription, I pray saying that this should work for my client. When I start my surgery, I pray, with a small prayer saying that I should be able to do my best for the patient whom I'm operating today. And when I end again, I pray this should work and the patient should get discharged from the hospital and get better without having any complications or side effects. So as a habit, I began with that. And it's not just my Hindu clients who had dementia. It was acceptable even to the Catholic clients. It was just a beginning. After greeting and just having the introductions again and again, because they were dementia patients, I had to introduce myself and repeat my name to my clients. So let me just share what one of the gentlemen who I was giving music therapy to told me at the first visit. I introduced myself, and then I said, "This is my name, and I'm here to, sing for you, sing with you, and we are going to play some music along with you, and we want you to sing along." And then the first thing he said was, "I like music, but then don't be upset if I forget your name when you come next time." So I told him, "Don't worry, I will be reminding you each time what my name is." So he was aware that what is going on. He was aware that he would not, he could not remember many things and he would be forgetting. And in fact, his wife was all the time saying that today he remembers my name. Next day he asked me, "Who are you?" He doesn't know my name at all. And uh, after 2 consecutive days, this is, I'm just sharing the experience that I had with this gentleman. The wife was actually in tears, saying that he doesn't know who I am, he doesn't know my name, and all that. Then I said, okay, let's see what is going on. And her name was Yashoda. So in the music therapy session, and this gentleman liked classical music as well as devotional songs, and he liked the old Hindi film songs of Rafi Saab, and particularly his wife told me that he used to love the song Chaudhary Ka Chand Ho, which was sung by Rafi, and he used to sing it very often for her. So after my usual prayer, I began with singing this Kannada song for him. Yashode Ninnaya Baga Yenu Roopane. And through the song he was listening to us with it, and at the end of that, he called out to his wife. He said, "Yashoda, can you get me a glass of water?" And that was, I'm so touched. I'm actually moved to tears as I'm sharing that experience that I had. And subsequent visit, we decided to that we would play the Rafi song Chaudhary Ka Chand Ho for him on the violin. So my student prepared for that song, though he could not play that song on that visit. So he prepared to play that song on the violin for the next visit. And we start playing the song, and then he says, "Yashoda, don't you know I used to sing this for you? Do you remember?" So this is the kind of experience we got with this particular gentleman. And if I go on sharing experiences of each one of them, I think the time that is given to me I will be exceeding the time. So what we noticed in the mean quality of life scores, see, I have not analyzed each component which this scale assesses. It is just the mean score that I'm showing. Before music therapy and after the 4 weeks, there was a significant increase in the Alzheimer's disease related quality of life. So I'm not here to of course these numbers and these graphs are important, but even otherwise, for me, what was more important, that I could make a difference. I could make a difference to these in the lives of these people, and that really was heartwarming for me. Now, what the feedback was given from the caregivers, it was really encouraging. They told us that these people were less agitated, their verbal aggression as well as physical aggression reduced, they were able to sleep better. And what about the caregivers? Because when it comes to the dementia patients, it is the caregivers who are actually, they give up. And, most of them, they decide to leave their loved one in a senior care center or elsewhere, the family members, because they are so stressed taking care of them. And imagine your own loved one is not able to recognize you, who has actually loved you all through your life, is exhibiting aggressive behavior with you all the time, agitated, and you don't know what they are talking at times. So because of that stress, they end up leaving them in the senior care facilities. But with this therapy, the caregivers said, we feel less stressed, we sleep better, and we are feeling more hopeful that this person is, maybe I know, like, I can't say that I would make a difference, and the difference would actually reverse the disease. That will not happen. But they felt hopeful, they felt that there is a little hope for these uh, so just to discuss the impact of music on persons with dementia, it evokes emotion. They remember certain activities or make subconscious associations. And when you pair music with their daily activities, it improves cognition and recognition of daily routines. So they have difficulty actually with even performing daily tasks like brushing their teeth, taking a bath, and they forget that they have had their food, they forget they have brushed their teeth, and it's very difficult. So when you pair the music with the daily activities, they will be able to, formulate that routine for themselves and stick to a daily routine. And musical aptitude and recognition remain for the longest, even through the progression of Alzheimer's disease, and it also increases the bonding with the caretakers. Uh, Music in persons with dementia will enable to minimize the behavioral and psychological symptoms. It reduces agitation, abnormal vocalization, and aggression. It can help reduce distress, anxiety, and depression, enhances communication, because these persons will, over a period of time, they will lose their speech and language as well. So when we give music, they're able to retain their speech and language, and it can help them express their feelings and ideas, and also reduce the medication use. And it encourages physical exercise, dance, or movement. So actually, when we had the bhajan sessions for these people, we gave them the rhythmic bhajans, where we told them to clap along. Now, whatever we said, whatever you like, you can do, but we encouraged them to clap along. We gave them these handheld instruments like the karatala or the dholki to play, and we chose simple, fast bhajans like Krishna Rama Govinda Gokula Nandana Gopala Krishna Rama. So things like these small bhajans, Shambho Murare Shankara Murare Murahara Gadadara Shankara Murare. So we chose these kind of bhajans, and there were days when we played this only on the instrument. There were days when I sang it, and then we had, especially in the senior care center, we had elders who were not having dementia, so they used to repeat the songs, and they used to sing along and all that. So we requested these participants also, dementia participants also, to join us. And we found that they would try and at least join us for a couple of lines. And that's how when they started clapping, and when they started playing the instrument, there was some kind of physical exercise. So any music which encourages some kind of movement actually it works as a brain gym. So
Dr.
so
Vijay, sorry to interrupt. Yeah, it's like almost 3 minutes more if you
yeah,
can
I will be
please.
finishing. Yeah, I'll be summarizing. Yeah.
Thank you.
So, music interventions can enhance quality of life by facilitating social interaction and connection. They can improve well-being, decrease the stress hormones, improve mood and elicit positive feelings, improve cognition, restore a sense of self for somebody who has dementia. It can bring in joy, help them to express their feelings, and also improve the well-being for caregivers. And how we planned the music therapy session, how it should be planned, it should start prior to the peak level of agitation, and the listening should happen half an hour before the difficult task. I told you they have difficult tasks like buttoning the shirt, eating their own food, brushing their teeth, and give it for a duration of approximate 30 minutes, and where it should be given, wherever the client spends majority of the time. And the caregiver or the music therapist should listen together with the client, and you encourage them to improvise, compose, provide them instruments, encourage movement, and also give them group music experiences. So, music therapy can reduce depression among the elderly, decrease the frequency of agitated and aggressive behaviors, and music interventions. We can use, again, Indian music to interventions can be designed to enhance social or emotional skills, assist in recall and language skills, and decrease problem behavior. And individuals with dementia do respond to music. So I would like to acknowledge Dr. Durgesh Upadhyay for sharing the music preference scale with me. And this slide just shows some of my references. Uh, I thank you all for listening to me patiently, and I would request all of you to give me your valuable inputs, so that we can make life for these seniors who cannot remember better. Thank you once again.
Thank you. Thank you so much, Dr. Vijay. Uh, Definitely moved by your presentation. I think the way you started it with the science background and then you slowly moved into the emotion background, and then I mean, putting them both together. I think that is what Dr. Vinod ji was also talking about, like, where both meet. And I think, and also the research that you shared earlier, and not only just the success stories, but the failure ones. I think that also highlights, how we look at research paper and what do we get from it. And that was a beautiful thing that you shared, that you start with a prayer, and it's not for the audience, but it is for our own self, because when we pray, we want to do something good, so we are praying for our own self. And it also puts the other person in a receiving mode, because then they don't think about the religion, they think about your well-being too. So I think it's a beautiful practice. And you talked about folk music and devotional and bhajans that Siddharthi talked about. So excellent, excellent. Thank you so much for all that you shared. And I'm also moved by, I think you're one of the very few people who always remembers to acknowledge whomsoever they have got the information from or knowledge from. So I'm touched by that. Thank you. We'll move to our next presenter today, and the last presentation for today. That's Miss Anarita Simonka. She's been there with us for the conference, and then we are really, really honored to have you, Miss Anarita Simonka. Miss Anarita Simonka was raised in Brazil. She's an innovative artist with many skills, infusing dance and music from different traditions. She is a singer, songwriter, and multi-instrumentalist. She explores mind-body techniques for therapy based on her training in yoga, meditation, and many academic certifications. Welcome, Ms. Anna. Looking forward to what you have to share.
Namaste, everyone. Can you hear me?
Yes, yes, we can. Namaste.
It's a privilege to be here, and I want to share with you my PowerPoint. Can you see that?
Not yet. Probably it's coming up.
Is it visible?
No.
Can you see my screen?
Not yet.
Not yet.
I think during the testing it was coming up.
Yes, it was okay. Let me try.
Yeah.
Well, I don't know. It's not working.
Let's wait for Miss Anna to join in. I think she's figuring out.
So in the meantime, Vidya, Shobha, somebody has mentioned that it would have been better if you could share the videos and the photographs of what you did and the reactions. I do have videos and photographs, but for the simple reason that I have not taken the consent to share them in a portal like in a forum like this. I have not shared them. So once I have the photographs, I have the consent, I will be able to share them with you all. Thank you.
Thank you. Thank you, Dr. Vijay. Miss Anna is back. Yes, we are able to see now. But you are muted right now, Miss Anna.
Can you hear me?
Yes, now, yes.
Okay, yes. And is it visible now?
Yes.
Okay, okay. So, I think it's a better.
F5 para maximizar.
Is perfect.
Yes.
Okay. And before starting my presentation, I would especially like to thank to Dr. TV Shairan for the support I have received, and also to all the NADA Center and IMTA family for this invitation. It's an honor to be part of this work. And also many thanks to my family, especially dedicated to my husband, Carlos Esteban. My topic is vibrational and meditative techniques for music therapy sessions. My personal approach to active music therapy is quite unusual because it's a result of my skills as a Brazilian artist, along with my training in many traditional healing sciences such as yoga, Sufism, Indian and Arabic music. Why do I prefer the active approach in music therapy? I was raised on a musical family from popular artists in Brazil. My father is a renowned popular dancer in São Paulo, and my mother's family was also involved in folk and religious festivities. Since from my childhood, I have been witnessing the therapeutic aspects in popular music and social dance. Religious and folk festivals are an incredible source of therapeutic and healing techniques, despite they are totally intuitive. From this so rich experience, I concluded that active music therapy has existed long before any theoretical or scientific approach. It's like a hidden wisdom with an universal expression through folk and popular music and dance. I believe that we can think on this heritage as being spontaneous methods on how to use sounds and movements to guide people into a purifying process, which includes the physical, the psychological, the social, and even the spiritual aspects. And the most important, in my experience, I believe that active music therapy brings a huge incentive to help people to create their own healing practices using music and dance and going beyond a regular music therapy session. In other words, it can stimulate a more permanent healing process by making people more independent from the therapy session. My work has three main influences. India. My basic training in vocal techniques and Hindustani music from the singer and teacher Ratnabali Adhikari, who lives in Brazil. My post-graduation in yoga, based on the scientific approach by Swami Kuvalayananda. And I am a certified music therapy from NADA Center program. Sufism. My Sufi training in chanting, drumming, and dancing meditation by the guidance from the renowned Master Adnan Sarhan, founder and director of the Sufi Foundation of America. And my personal experience in Brazilian traditions on music, dance, religions, and popular festivities. In this picture, I'm dancing with my father, and the vintage photo is my uncle in the 50s with popular folk drummers in Brazil. Now we will share some concepts and exercises on how to enhance results in a music therapy session, introducing vibrational and meditative techniques to create active music therapy sessions. We will also demonstrate how folk and popular music and dance can provide a precious source of techniques and tools to inspire practices on vibrational and meditation healing. Finally, we will give many ideas on how to help people to practice active music therapy, even if they don't know how to play musical instruments and they are not dancers. But first, what is active music therapy? Active music therapy means work in a session with movements, mind exercise, breathing techniques, and we can also include practices involving small groups and communities. What are vibrational and meditation tools? In these practices, we extend the experience of the music to open our sensibility to reach the subtle energy levels. We work on the awareness of the different states of the mind. We expand the self-knowledge of the relationships between body and mind. And we make the healing process active rather than passive. Active music therapy also means to be committed with a more creative participation from our clients and patients, showing them a new way to explore their creativity. How we can do that in a music therapy session, thinking in long-lasting results? Some suggestions. Teaching our patients simple exercise that they can learn and repeat whenever they feel the need. Making this exercise as a complementary therapy for their specific problems in all the levels, such as physical, psychological, energetic, social, etc. Making sure that these exercises are easy for them as an inspiration to create new variations by themselves, stimulating their creativity, working with group sessions, and stimulating our patients or clients to share the practices with their family, friends, and colleagues. And now, let's go to the active music therapy experience. Practice. I'm going to guide you on 3 exercises that you can use with your clients, patients, friends, family, in many situations. All of them have the same topics. They work to awake intuitive feelings, sensations, and emotions. They awake people on how to turn these intuitive aspects into a more intellective stage. By learning these active meditations, the people can repeat them as they need. Important. They are very simple techniques and easy to follow, such as movements, breathing, mind control, body percussion. They can be done even by people in very poor health conditions. All of them are very inspiring to work with groups. 3 practices in active music therapy. We are going to describe the following techniques. Drumming pranayama, dancing hands, and dancing with an imaginary partner. Drumming pranayama. Here you have 2 pictures. It's native people from Brazil who uses lots of body percussion, and a picture of Brazilian traditional drums. This exercise is inspired by native indigenous people from Brazil who gathered together to make this body-mind ritual. The exercise also has many similarities with the Sufi drumming meditation, combining music, breathing, and body percussion. How to do? Choose a music where there are a very clear and basic pulse made by drums. Play the music and try to feel the beats of the drumming as if they are your own heart beating. Release your breathing to follow this pulse and tap your chest gently, following the pulse of the rhythm and making a regular massage. Results and benefits. This exercise instantly changes your heartbeat to a more comfortable rate. It's good to decrease high blood pressure and makes you feel good and relaxed. It's easy and very effective to be done by a group of people who needs social interaction. I'm going to invite you to perform. So you feel the pulse. You can close your eyes if you prefer. And try to feel your heart beating along with the pulse. And you gently tap your chest. Let's go to the next practice, dancing hands. Here you have a Katak dancer, a flamenco, and a Brazilian dancer, the famous Carmen Miranda. Dancing hands. In this exercise, we will stimulate the vital energy to a better flow. It's inspired by many styles in classical and popular dances across the world. We can see these movements in Indian Kathak, Spanish flamenco, and Latin American dances too, combining music, rhythm, and hands movements. How to do? Choose a very romantic and inspiring song. Invite your patient or client to stay in the mood. The exercise is simple. Rotate your wrists while inhaling. Relax your wrists as you exhale. Results and benefits. This exercise keeps your vital energy currents flowing and offers a creative opportunity to express deep emotions. It's energetic and stimulating. Try it in a group session. I'm gonna show you. So you release your breathing. You can close your eyes if you prefer. Inhale and rotate your wrists. Relax and exhale. Inhale. Exhale. Inhale. Exhale. Inhale. Exhale. Our next practice, dancing with an imaginary partner. This is inspired by the Sufi practice to go within the beloved. And you have here the Krishna Lila. This exercise aims to bring you the feeling of being protected and sharing love. I have seen the movements that I use in this exercise many times across the world with many similarities. It's presenting both in folk dances and mystical trance practices such as Hare Krishna Bhakti and Sufi, as well as in physical training in Latin America tango. And recently I saw the same movement in Kabbalists from a Hasidic tradition from Jerusalem, combining music, breathing, and torso movements. How to do? Choose a sweet instrumental music with a very regular rhythm and adorned by celestial sounds such as harpa, sitar, veena, flutes, Tibetan bowls, angelic voices. Invite your patient to stay in the mood. The exercise is simple. Put your right hand over the left shoulder and your left hand over the right shoulder, like this. As the music is playing, release your breath and gently make regular movements with your torso from side to side. Okay. Results and benefits. This exercise brings balance to the two vital energy currents in your spine. You can achieve a deep relaxation almost instantly. It's also very stimulating. Let's show it. Release your breathing, close your eyes. You can try this movement forward and backward, but for therapeutic role, I prefer side by side. How to apply these techniques? All these techniques are very recommended to the following situations: to help people to meditate easily, no need to fight with your mind. Recovering from disease, when someone feels unmotivated. Depression and anxiety, loneliness, trauma, etc. And it's especially indicated to the older and to the children. Thank you for attending my presentation. I hope these techniques can help you to create new active music therapy sessions. Okay.
Thank you. Thank you so much, Miss Anna, for introducing us to these three beautiful, simple techniques. So powerful, so powerful. When you mentioned about dancing hands, I was reminded of Mridulaji's demonstration yesterday during the singing session. And I was imagining that at some point in time, you will ask us to stand up, because dancing means it almost gives us that imagination that we will stand. But everything was done with sitting in this position, and I could follow exactly what you were mentioning. So amazing.
Actually, you can dance with just your fingers. If you have a patient that cannot move the body, but still the fingers and the mind and the feelings together are there.
Right.
And I really believe in simple exercise, because when you go to the popular music and dance, every place you go, they are not educated people, but it's incredible how they have a fresh intuition about their body, and they never crash the limits of the nature.
Yeah.
And when we go to most intellectual conditions, frequently people break the limitations of the nature, trying to make things that they are not able to do.
Yeah.
So always you must begin on the first steps.
True. Absolutely. Absolutely. And while you were mentioning about this dancing with imaginary partner, doing this, I'm reminded of Sharon Salzberg talking about self-love. And she mentioned that she heard this phrase somewhere, and it has stuck with me forever, that love is not just a feeling, but it's an ability. I think we all have that ability to love, and we think that it's a feeling that somebody has to give it to us for making us feel loved. But when we do this, it's just self-love that we are giving ourselves, and we will probably ignite our ability to love everyone. So thank you so much, Miss Anna, for sharing these tools with us. And I, for one, will make use of this in my yoga sessions daily. So thank you so much.
Many years ago, I was in a ballroom dance in Argentina learning tango. And when you are dancing in a couple, you have to have a telepathic relationship because there are only the bodily language. And before they began the tango classes, they make an exercise. Everybody stand up and put the hands on the chest and they play the music, and people try to synchronize the breathing with the music. And when these are synchronized, then they start dancing. Only after that you can walk.
Beautiful.
It's so
Beautiful.
beautiful.
Yes, absolutely.
I'm ready to answer your questions if you have more. And I'm honored to be here. You are extraordinary people making a fantastic work. Thank you so much to be here with you.
Thank you so much, Ms. Anna. I think we are equally honored to have you here. And thanks to Dr. Sai Ram, sir, who is the pillar behind IMTA, and to all the other members, like senior members like Dr. Vinodji and Dr. Vijay and Siddharthi. Everyone here is putting our hearts into IMTA, and hopefully it's going to grow like how we want it to grow. And I see that most of the questions have been answered by the respective presenters already. I noted some and then I saw the answers also coming in the chat box. If there is, okay, there is a question to Miss Anna. Can Miss Anna elaborate on the imaginary partner technique?
Please be more specific in your question. What do you want to know more specifically?
What is the, okay. So she's asking, imaginary dancing partner, when do you use that?
Well, I gave you the example of the tango and the ballroom dances. Everybody who goes to a ballroom dance are searching for friendship and for joy and for sharing emotions by dance. So you can use this practice every time you see the people need to get an inner connection with love. And you can use when you have someone who has many difficulties to express their feelings.
Thank you. Thank you so much. Yes.
And in case if you have any students more interested in the mystical states, you can also use this because it's about the love by Allah, by Krishna, and by Jesus. Why not? This is an expression of universal love also. Okay?
Thank you. Yes, so Ms. Farah is saying, so probably it can help people come out of their inhibitions.
Absolutely. Absolutely.
Thank you.
And you can suggest them to close their eyes. This is really important.
Right. I don't see any further questions. I think there was one question which I noted, but I'm not sure if Dr. Vijay answered it. Dr. Vijay, are you here?
Yes, Shobha, yes.
So the question was, geriatric depression scale may please be shared if possible.
Yeah, I saw that question. I think Nina ma'am has asked it. I will mail it to her personally. Yeah.
Okay, thank you.
Because I have not used that scale. I too have to get that scale and then share it. I will definitely share it, but it's available. Yes.
Okay, thank you
Thank
so
you.
much.
Why not share it on the group so that everybody gets benefit of that?
Definitely, sir. If the original authors have kept it open for everybody to use, then I will
Yeah,
share it. If
yeah,
otherwise,
sure,
we'll have
sure.
to
Yeah,
take
yeah,
permissions.
definitely. If it's available and permissible,
Yes.
please do that.
Yes. Yes. Thank you.
Thank you so much. And I think there was one more question addressed to Sushma ji, which I didn't see the answer in the chat. It was about how much data you have for the pregnancy experiments. Sushma ji, are you here?
I have never worked directly with pregnants,
Miss,
but
sorry, Miss
the,
Anna, this was directed to Sushma ji.
oh,
For,
sorry.
no
Okay,
problem. Thank you.
so
Yes, ma'am,
I'm
I'm here.
wanting you.
Yeah. Ma'am, can you repeat that question again?
Yeah, the
Shobhaji?
question is how much data you have for pregnancy experiments.
Not as much as to just research the paper yet. So probably I have to collect in more data on it.
Okay.
But
Thank you
just
so
as
much.
for the positive effect on it, so I thought it's, can
Yeah,
be used for. Yeah.
right.
Thank you.
Thank you so much. I think the other question you yourself answered, and Dr. Vijay also added to that in the chat box. I think that's all for the questions. We have lots of appreciation for all the presenters today. Please go through them. And I also would like to add the disclaimer here that the views, ideas, observations, remarks, inferences, speculations, etc., as expressed by the speakers and attendees in the conference 2021, as in the earlier ones, are not endorsed by IMTA, and hence IMTA is not responsible in any way for any or all such enunciation made or recorded. So this is a message from IMTA President Dr. Sairam and IMTA. So thank you so much. And also, I would like to just share one thing from the anchor's point of view. It's a very difficult position to be in the anchors without getting personalized. I have to feel connected to the topic to be able to share something. So those are all my personal views. And so if there is anything that offended anyone, so please be mindful that is just my personal view. Thank you so much. Siddharthi, do you want to add anything? Nothing. Okay. So thank you so much. And Dr. T.V. Sairam, sir, I think it's like Vinodji said, right? We have all the people here with so much knowledge, and I think I always look up to Dr. Sairam sir to have somewhere I feel emotionally connected. He brings in the emotion perspective, and I look up to Dr. Vinod and Dr. Vijay to come from the scientific perspective as well. And so I look up to them from that perspective, and many members here. I look up to them for various things. So I hope all of us come together to grow this IMTA platform. I remember the first meeting that we've had. We were all so excited to get something done, and hopefully we are on the right track. Thank you, Sairam sir, for all your guidance and for including everything. It's not just science, it's not just emotions, including every one of us and making us feel that yes, we can contribute as well. So that's very, very important. Thank you, Dr. Sairam sir, and all the IMTA office bearers for making this happen. And we have, of course, the afternoon session, also the singers session, music for music therapy session. Thank you, Miss Anna, for being our guest of honor today and sharing your experiences. We will meet at 1 p.m. sharp for the music for music therapy sessions. Again, we look forward to a lot of therapeutic music, and yeah, we'll meet at 1 p.m. It is 12:18 right now. We'll see you at 1 p.m.
Thank you, Shubhaji. Thank you for conducting it very well. And we all really